Thank you for having me here today to lay out House Bill 5. To follow up with Representative Lewis, he's kind of laid out some things. Representative Chairman Thompson mentioned, we've done compacts in the past. If I'm looking at this concept, it's not new to our state. We've had through the years a lot of compacts that were approved. Texas entered its first interstate compact in 1935 to preserve oil and gas. Today we have, by my count, 24 compacts ranging from water rights, fire protection, education, prisoner exchanges, and beyond. The most recent compacts were in 2005 when Representative Haggerty introduced and passed HB 706 to update the interstate compact for juveniles, and also in 2005 Rep. Island authored and passed HB 2613, the Interstate Insurance Product Regulation Compact. So compacts, as you all know, are authorized under Article 1, Section 10, Clause 3. It's interesting, between 1783 and 1920, there were only 36 compacts passed in this nation. In the past 80 years, over 150 have been signed and passed. So the concept is not new. I wrestled in my heart how I was going to lay this out today. You can see I've got more information than anybody could process. I've handwritten my own notes. I've fussed at my staff. I've thrown their stuff out, and I've gone back and forth, and I could work you through the bill. I'm going to tell you how I got to why I'm carrying House Bill 5 today. I was kind of thrown into this public health deal. I didn't ask for it, Ms. T. And I kind of had to sit back and say, oh my gosh, I'm an appropriator. And Judge Lewis talked a little bit about some unsustainable things, and he talked about what we do here is education. That's what we come here to do. And Judge, I'm going to agree but disagree with you. When I was doing Article 3 of the General Appropriations Act, that's what I thought we did. We did public ed and higher ed, and God dog, what's this Article 2? And you're crowding me out, and I would tell whoever was doing it at the time, John Davis, those people, you're spending too much of my money. We got to put this all in Article 3. I kind of got thrown into this public health thing. And what I disagree with you on, Judge, is we also come here to provide a safety net for how people access health care. My classmate, Trey Martinez Fisher, I don't think I ever called him Trey. I call him Trey Martinez Fisher.
You told me a few things, I think.
Yeah, I've called you a few things when we were melting down on the local and consent last session.
A couple of them.
Yeah, a couple of things. You exchanged a few back, and then we hugged and we said, we're after the same thing. How do we get out of this mess?
That's right.
I would say today, how do we get out of this mess? So, not going to belabor this, but one of the things that I went in as chair of public health was I started scratching my head and saying, why does everything cost so much? Why does everything cost so much? I'm not talking about Medicaid. I'm talking about health care. Why does it cost so much? Why can I have a computer that's the size, it's thinner than this little thing right here, and that cost me $800, but if I went and got an MRI today on my knee, it'd be $3,500. Now, I was not real popular when I started asking those questions last session. In fact, I'm sure that they were beating a path to Speaker Strauss's office saying, get rid of her. She's asking the wrong questions. But I thank President Obama for a conversation he opened up in May of 2010. And what he opened up in that conversation was who should have health care. And then everybody started looking at, gosh, how much is that going to cost us? And then it led them to numbers like Medicare for the unforeseeable horizon is an $88 trillion unfunded liability. Okay? So fast forward that Governor Perry I think it was after the elections, Ms. T kind of said, well, we're going to opt out of Medicaid. We don't have to do Medicaid. It's completely, it says it. You don't have to do it. And I got a little nervous, and I said, oh, my gosh, I better start studying on this stuff. And as y'all may know about me, I don't like to leave Brenham very often. I don't like to fly up to Washington, D.C., so I got on conference calls, and I started asking people.
And sometimes you don't like to deliver favorite ice cream either, do you?
I like to deliver that ice cream. So it kind of left me I was on some conference calls. And I said, well, could we opt out of Medicaid? Could we? And here's the thing that Ms. T asked. Yes, we could. but would that be wise? We actually could probably do it for health care for the poor children. As you know, Medicaid really is about poor children's insurance. But the largest driver, the 63% of Medicaid, is aged, blind, and disabled. That's 63% of your Medicaid budget, and you can't do it with that. And I think Governor Perry even backed off of that, which led me during that conference call with someone in Washington, D.C., to say, have you looked at an interstate compact? And then I said, well, nobody's ever going to do a compact with Texas. We're too big. But here's the beauty of the compact. The compact actually kind of sets out and says, this is our baseline funding. And you're going to hear today from people that say, don't tie us in. Don't tie us into a number. We're a growing state. The problem that we see with Medicaid is that we're a growing state, and FMAP doesn't realize that. Why doesn't FMAP really realize that? Because FMAP is the poverty rate affected Medicaid through federal medical assistant percentage, FMAP. The FMAP rate is derived from each state's average per capita income. As the state's per capita income increases in relation to the national per capita income, the federal match rate decreases. So the more jobs we have, the better we're doing. Our FMAP decreases. Drew, you're on appropriations. You know that we're down to about 58%. Our Health and Human Service Commissioner says we're going to eventually go to 50%, which the federal law says you can't go below 50%. Now, we were very fortunate with the ARA funds that enhanced our FMAP to a little over 72%. House Bill 5 takes that snapshot when we were at 72% and freezes it there. It has within it a formula that helps us grow according to the growth in our state, not the per capita income, which FMAP is tied to today. And we're going to continue. The more we have employed, the more our FMAP is going to continue to descend. So, in theory, I have to tell y'all, as y'all wrestle through this bill, I am not about to sit up here or stand up here and tell y'all, do I have sleepless nights with my name next to HB 5 asking permission from the federal government, from the United States Congress, to give us our money and let us see if we can do a better job. You might also ask, well, what other state are you going to get to do it, to help us do this? There are 10 other states currently that have legislation moving, and another 8 states are in the drafting stages. That brings us to 19 states that are seriously considering this at this point. You do, as you know, compacts have to have 2 or more states. I've looked at this commission that we have to have, and you have to have a commission that overrides in a health care compact. And it's pretty interesting, that we would have a membership. We'd have 2 members and 1 vote on it. I've kind of looked at the commissions, and what they do is, they help us converse with other states, and every state is struggling with how they're going to do Medicaid. My bill throws in Medicare. And with that, you should ask a lot of questions with that too. Why are you putting in Medicare? I guess why we're looking at Medicare is that $88 trillion unfunded liability. Also, the Patient Protection and Affordable Care Act that passed last May. In that bill, it starts to peel back Medicare. Why? Because they have to pay for the expanded population that we're going to see in Medicaid. Today, my friends at the Texas Medical Association, we had a great argument, okay? And my bottom line to them was, the path that we are on cannot be sustained. Every economist, whether they're Democrats or Republicans, are saying we cannot maintain this. The joint commissions are saying we're in trouble. You've got the dollar is kind of upside down. There's even talk that it won't be used as the world monetization. We got problems. All HB 5 says to the federal government is, I'm asking your permission to block grant this money to us. If you'll do that, I can guarantee you I don't want all the seniors marching on the state capitol, but I can tell you this much. I believe that seniors have a better chance of talking to their state representatives and their state senators than they do to a congressman from New York or Delaware or New Jersey or the state of Washington. No perfect and simple answer. President Obama has said that when he laid out his stuff. We're all wrestling with it. I will confess to you that I'm coming at it from all angles. HB 13 is a global waiver, 1115 waiver for Medicaid. This administration, we have not been successful on getting Medicaid waivers. Not under Bush, not under anybody. This administration actually has given more Medicaid waivers than any other administration. I don't know if the compact's going to work. I feel pretty good about asking permission from Congress. Our track record says CMS has not been very nice to Texas or any state when they look at global waivers or any kind of waivers. It would be nice to get the money block granted to us, that then when we have to make changes to our program or there's some innovative ideas, that we don't either have to amend our state plan, go to CMS, wait for months, maybe even years for them to say yes to an amendment to our state plan, or worse yet, approve a waiver, and they have to approve a waiver. They can't turn down a state plan amendment. I think that it's easier to go to the legislature and go to the appropriations process or the Public Health Committee and ask for that permission and make those changes and do more with our dollars. I will tell you all this. This bill is not about throwing people off the rolls. You know why? They're going to show up in our ERs. They're going to find health care somehow, some way. This is about managing our dollars better. I read an article last night about a Medicare fraud where a couple of guys actually set up, erroneously, people. They did all these different procedures, and they got away with $100 million. How much could we serve with $100 million? Do I think that Texas could oversee Medicare better than the federal government? I do. I think the people in this room are a lot more attentive to the needs of Texans than other folks.